This is a very high yield GI question for step 1, so stick around if you want to learn something new and high yield. A 30-year-old woman presents to the clinic with a 6-month history of crampy abdominal pain, intermittent diarrhea, and unintentional weight loss. She's also noticed occasional rectal bleeding. She has no significant family history of GI disease. On examination, she is afebrile but appears mildly malnourished. Abdominal tenderness is noted in the lower right quadrant. Lab studies show an elevated CRP and anemia. Colonoscopy reveals transmural inflammation, a cobblestone appearance in the terminal ileum, and areas of skip lesions. Biopsy of the affected areas demonstrate non-caseating granulomas. Which of the following is the most likely diagnosis? So A, ulcerative colitis. Ulcerative colitis typically manifests with bloody diarrhea. However, you see the mucosa and submucosa affected. You do not see transmural inflammation. You also see crypt abscesses instead of non-caseating granulomas. For this reason, A is wrong. B, Crohn's disease. This is the correct answer. When you see non-caseating granulomas, bloody diarrhea, skip lesions, cobblestone appearance of the terminal ileum, these are pathognomonic for Crohn's disease, and I want you to choose that immediately. So B is the correct answer. C, infectious colitis. So infectious colitis usually occurs with traveling or recent antibiotic use. You don't see skip lesions and non-caseating granulomas. You see fever, abdominal pain, diarrhea, but this is not characteristic of infectious colitis in this vignette, so C is their incorrect answer. Ischemic colitis is acute abdominal pain. Usually you see lower left quadrant pain, you see bloody diarrhea. Usually it's after recent surgery, or if you've had atherosclerosis or history of high cholesterol, you see something like ischemia of the bowel. So D is the incorrect answer as well. E, celiac disease. Celiac disease is an autoimmune disease characterized by IgA immune complexes attacking the small bowel. You see villous atrophy, malabsorption, and diarrhea and weight loss. You do not see transmural inflammation or cobblestone appearance in the terminal ileum or anything like that. Therefore, E is wrong, and here you have B is your correct answer. If you like this video, please follow our page, and thank you for watching.